Hello, my name is David Protajuk. I'm a nursing student at Indiana State University, and today I'm going to be providing health education about long-acting reversible contraceptives, or LARC for short. I'm going to be using the abbreviation LARC a lot through the PowerPoint presentation, just to make speaking a little bit easier. So when I use the abbreviation LARC, just know that it refers to long-acting reversible contraceptives, which are an extremely effective method of birth control. This PowerPoint is geared towards a specific population at risk. And when I say population at risk, I'm really just saying it's geared towards a specific group of people. It's meant to benefit them. And the group of people that I'm talking about is females at risk for unintended pregnancy. So hopefully, education about long-acting reversible contraceptives will reduce the risk for unintended pregnancy. That is the goal. We also have other learning objectives, which are takeaways from this health education video. So I'm hoping that you learn, as the viewer, these 6 learning objectives and that you are able to successfully understand these objectives by the end of the video. And I know they may seem complicated at the moment, but as the video goes on, you will begin to understand them. So the first learning objective is identifying factors that increase the risk for unintended pregnancy. The second objective is to provide a broad definition for long-acting reversible contraceptives. The third objective is to distinguish between the different types of long-acting reversible contraceptives. The fourth objective is to understand the effectiveness of LARC in reducing unintended pregnancy. The fifth objective is to recall the procedure for intrauterine contraceptive placement and removal. The sixth objective is to remember the procedure for implant placement and removal. At this point in the video, I would kindly ask you to click the pause button and take the pretest exam, which is located in the description below the video. Now, the pretest exam is meant to assess your knowledge, assess how much you already know about LARC. It's meant to serve as a baseline, if you will. And then at the end of this video, you're going to take the posttest exam, which is the exact same exam. But the reason you're taking the pretest at the beginning and the posttest at the end is to see how much you have learned from this PowerPoint presentation, how much you have benefited from it. So you may see a rise in your score from the pretest to the posttest, meaning that you took something away from this PowerPoint presentation. There is also a brochure in the description below which can provide further information about LARC. It includes literature and resources for more information. So, who is at risk for unintended pregnancy? Well, about 50% of pregnancies are unintended according to the Center for Disease Control and Prevention. But there are certain factors that can increase the risk for certain populations. Some of these factors can be controlled, some of them cannot. So a factor is adolescents, which are 15 to 19 years old, have a higher risk for unintended pregnancy, as well as young women who are 20 to 24 years old. Racial or ethnic minorities can be at a higher risk, as well as women with a lower education or income. Now let's get down to it. What is LARC? LARC is an extremely effective and reliable long-term birth control method, and LARC is 98% to 99% effective. It is the most effective method of birth control, and the reason that it is because LARC does not require any regular maintenance. For example, birth control pills require regular maintenance, such as taking a pill every day at a certain time. And life can be chaotic. Not everyone remembers to take birth control at a certain time. Sometimes people might skip a day. This is why LARC is so effective, because it requires no user action. Simply a small procedure is needed to insert a very small device in the body, and that device will help with effective birth control from 2 months to 10 years. hence the long-acting part in long-acting contraceptives. They can work up to 10 years, according to Planned Parenthood, which I entirely recommend checking out. The Planned Parenthood website can provide more information. So there's two different types of LARC. There's the intrauterine contraceptive, which is a tiny T-shaped device placed in the uterus. Intrauterine contraceptives, or IUC, can be hormonal or copper. Progestin is a common hormone in these devices. Generally, if it's hormonal, it'll last 3 to 5 years. If it's copper, there's no hormone, simply the copper prevents fertilization. The element copper prevents fertilization, and copper ones are cheaper and they last longer. They can last up to 10 years. Implants are the thin plastic rods. They're placed in the upper arm. They release progestin, the hormone we already talked about, and they last up to 3 years and they stop ovulation. Implants are different. They're not placed in the uterus, they're placed in the upper arm, and the placement of these LARC is the way that they're classified. So an important takeaway from LARC is that they do not provide protection against STDs or STIs. They don't provide protection against sexually transmitted diseases, STDs, or sexually transmitted infections, STIs. This is a very important concept because while they are great methods of birth control and preventing pregnancy, they don't prevent STDs or STIs, and they should not be used for that. So here we have a graphic of the examples of LARC. The intrauterine contraceptives are the T design placed inside the uterus, and the rods are placed in the upper arm. So what's really interesting about this visual is that they're comparing them to a quarter. So these devices are really small. They're measured in terms of centimeters and millimeters, and they're about as big as a quarter. So when you take a quarter and you look at it, you'll kind of get the sense that these devices are really small. So I think it's great to have that reference point of a very common item for these devices. So how is IUC placed? How is an intrauterine contraceptive placed? Okay, first of all, an OBGYN does this, which is a trained doctor. An OBGYN stands for an obstetric gynecologist. Obstetric gynecologists are trained in women's health, pregnancy, post-pregnancy, and they're the doctors that place intrauterine contraceptives. First, they'll take a look at your medication history. They'll look at you as an individual and take your pelvic exam to see if you're eligible. If you are eligible, they'll guide the contraceptive through the vagina, cervix, and then the uterus. There is some temporary discomfort during the procedure, which can be relieved by an OTC, or an over-the-counter medication such as ibuprofen. Again, this procedure only requires OTC, over-the-counter medication. You're not going to be put to sleep or anything like that. It's a very simple procedure. There might be some minor pain and discomfort, but that's about it. And we have removal. Removal is easier than insertion. The intrauterine contraceptive has plastic strings meant for removal, so your OBGYN, obstetric gynecologist, will grasp the strings and slowly remove the contraceptive. It takes less time than insertion. And now we have implant placement and removal. Now the implants are not placed in the uterus like the intrauterine contraceptive, they're placed in the upper arm. So with insertion, the OBGYN, the obstetric gynecologist doctor, will numb the area in the arm with a local pain medication. It's not going to put you to sleep or anything, it's just local. So then they'll take a special inserter and place the implant in the arm. This procedure only takes a few minutes. Removal, your arm's numbed once again. They make a small incision and they expertly remove the implant. Again, I think what's important to remember is these implants are about as big as a quarter. They're not very big, and these are very small procedures we're talking about here. There you have it. There's my presentation. At this point, I would urge you to take the post-test in order to see what you have learned. I would urge you to look at the brochure if you would like to know more information. The brochure has a lot more information and a lot more resources and references, here are the references I